सामने हाजिर करते हैं। So hello students. Chalo. So hello to all of you. Let us begin with embryology. Embryology, important topics of embryology let us cover today. Okay. Now, general embryo, primitive streak is very important. Primitive streak. Okay. Let me just begin this. Now see, this is the germ disc we are looking from up. Okay, this is the germ disc we are looking from up. In a side view, the germ disc would look like this. What are these tall and columnar cells known as? Yes, you can answer this. What are these tall and columnar cells above known as? And what are these cuboidal cells below known as? Yes, a quick revision of general embryo. Chalo bachcho. The tall and columnar cells above are known as epiblast, right? And the cuboidal cells below are known as hypoblast. This germ disc is made up of two layers, the epiblast and hypoblast. This is what we call as a bilaminar germ disc, right? Bilaminar germ disc. In the third week, we get the formation of three germ layers, and formation of three germ layers is known as gastrulation. So let us just understand what happens. The first thing that occurs here is this cuboidal cells, the cuboidal cells which are hypoblastic cells, they suddenly become columnar. They suddenly become columnar at one end. As they become columnar, they're going to push the epiblast upwards. And when we are looking from up, we find a rounded elevation here at the cranial end of the embryo, and this is what we call as the procaudal plate. Procaudal plate, also known as the buccopharyngeal membrane, right? So the cuboidal hypoblastic cells at one end, they suddenly become columnar. They form an elevation upwards. When we are looking from the amniotic cavity, this is seen as a rounded structure, and this is what we call as the procaudal plate or the buccopharyngeal membrane. This procaudal plate is going to form the future mouth, right? Now, once this procaudal plate is formed, exactly at the opposite end, this is the tail end, the epiplastic cells, they grow very fast, they grow rapidly. They form an elevation in the amniotic cavity, and this elevation is what we call as the primitive streak. Primitive streak. So, where is the primitive streak formed? At the caudal end of the embryo. How is the primitive streak formed? By the proliferation of epiblastic cells. This primitive streak has a rounded anterior end which is known as, yes, any guesses? What is this rounded anterior end known as? I can't see the chat, just one moment. What is this rounded anterior end known as? Anyone? Just one moment. I'm not able to see the chat. I'm refreshing the app. Just one moment. Okay. Hello to all of you. Now I can see the chat. Yes, hello. No, video is not lagging. So what is this rounded anterior end known as? It is known as a primitive knot or the primitive node. Primitive knot or primitive node. And inside this primitive node, there is a depression here. What is this depression known as? That's the primitive pit or the blastopore. Primitive pit or the blastopore, right? So these are tall and columnar cells. Okay, at the caudal end of the embryo, this elevation is known as a primitive streak. The primitive streak anteriorly is rounded. That's known as a primitive knot or the primitive node. In this primitive node, we get a depression which is known as blastopore or the primitive pit, right? Now what happens? The epiblastic cells, they enter into this blastopore. The epiblastic cells, they enter into this primitive pit or the blastopore. They get modified, and this modified epiblastic cells will replace the hypoblastic cells. This layer is now known as endoderm. So you get an MCQ, students. The first germ layer to be formed in an embryo is, your answer, endoderm. Again, the epiblastic cells, they enter into this blastopore. Again, they get modified and they form the second germ layer, and this is what we call as mesoderm. This mesoderm is inside the embryo. We call this as the intraembryonic mesoderm. Intraembryonic mesoderm, correct? And finally, the epiblastic cells again enter into the blastopore. Again, they get modified, and now they will replace the epiblastic cells itself. This layer is now known as ectoderm. Ectoderm. Are you following this? Right, this epiblastic cells, look once again, this epiblastic cells will enter into this primitive knot. It will go into the primitive knot like this. They get modified and they replace the hypoblast. That replaced layer is known as endoderm. The epiblastic cells again form a new germ layer, that's mesoderm, and finally they replace the epiblast, that is ectoderm. So bacho, the cell which is responsible for formation of all the three germ layers in an embryo is, your answer, epiblast. Okay, that's a very important MCQ. The cell responsible for formation of all the three germ layers in an embryo is epiblast. The first germ layer to be formed in an embryo is endoderm. Endoderm, correct? Now, so what is the function of epiblast, or what is the function of primitive streak for that matter? Primitive streak helps in the formation of the three germ layers along with epiblast. And the primitive streak also forms a process here. Can anyone tell me what is this process? A process which extends from the primitive knot to the procaudal plate. Yes, bacho, what is this process? A process which is formed by the primitive streak which extends from the primitive knot to the procaudal plate. Any guesses? What is this process known as? Yes, students. This is what we call as the notochordal process. Notochordal process. So what is the function of primitive streak? One, the formation of three germ layers with the help of epiblast. Second is the formation of notochordal process. Once this thing is done, once the three germ layers and this notochordal process is formed, the primitive streak disappears off. It disappears off. It goes off. But suppose if it remains, suppose if it remains in the region of the sacrum and the coccyx, and the child gets a tumor here. What is this tumor known as? The sacrococcygeal teratoma. Sacrococcygeal teratoma. So sacrococcygeal teratoma is due to persistence of primitive streak. Yeah. So primitive streak is a very, very important short note for you. Short note. Okay. Then something else I'll tell you in general embryo. Look, your chat is not visible. There's some problem with the chat box. Have a look, I'll just tell you. So these are the three germ layers which are formed. This is the ectoderm, that's a mesoderm, that's the endoderm. In this mesoderm, in the center, we get something here. What is this known as? This is the notochord. The notochord is formed in the mesoderm, and now this mesoderm is going to differentiate into three types. Yes, this is number one, this is number two, and this is number three. Yes, but can anyone tell me what are these three mesoderms which are formed here? The three mesoderm, that's number one, that's number two, and that's number three. Number one is the paraxial mesoderm, paraxial. Number two is the intermediate plate mesoderm, and number three is the lateral plate mesoderm. The paraxial, the intermediate, and the lateral plate mesoderm. You have to know the derivatives of this mesoderm. The derivatives, yes. The paraxial mesoderm forms what is known as the somites. And somites will divide into a dermomyotome and a sclerotome. Dermomyotome and sclerotome. The dermomyotome forms the dermis and the skeletal muscles. The sclerotome forms the vertebral column and the ribs. Right? So that's about the first one. That's the paraxial mesoderm. Forms somites. Remember, that's a very important MCQ. The intermediate plate mesoderm forms two major systems in the body. One is the genital and the second one is the urinary system. The genito-urinary system is derived from intermediate plate mesoderm. Correct? And the third mesoderm is the lateral plate mesoderm, and this lateral plate mesoderm encloses a cavity. What is that cavity known as? The cavity is known as the intraembryonic coelom. Intraembryonic coelom. Hi all of you. Intraembryonic coelom. Hi Rishi. Hi Snerjit. Okay, and this intraembryonic coelom forms all the body cavities. Which are these body cavities? The pleural cavity, the peritoneal cavity, and the pericardial cavity. Okay. But I'll refresh the chat in between. I'm not able to see the chat, but I'll see the chat in between. If there are any doubts, I'll clear that. Yeah. So the intraembryonic coelom is derived from the lateral plate mesoderm. The lateral plate mesoderm encloses a cavity, that's the intraembryonic coelom, and this forms all the body cavities, right? So to begin with, there's a communication, there's a communication between the pleural and the peritoneal cavity. Yes, there's a communication between the pleural and the peritoneal cavity. This communication is known as the pleuroperitoneal canals, right? Pleuroperitoneal canals. And this pleuroperitoneal canals are closed by what is known as the pleuroperitoneal membranes. Can anyone tell me what is this pleuroperitoneal membrane going to form? Come on, bacho. Just sit back and listen to the lecture. Don't write anything. What is this pleuroperitoneal membrane going to form? Yes, any guesses? See, to begin with, ये पूरा body cavity है, pleural, peritoneal, pericardial cavity. To begin with, the pleural and the peritoneal cavities are continuous with each other through the pleuroperitoneal canals. Later, there's the formation of a membrane which is known as the pleuroperitoneal membrane, which separates the pleural cavity from the peritoneal cavity. And what is this pleuroperitoneal membrane going to take part in the formation of? Yes, very good. That's the diaphragm. That's the diaphragm. So when we talk about embryology of diaphragm, the major contribution to the formation of diaphragm is, yes, answer this. The major contribution to the development of diaphragm is septum transversum. Septum transversum. Okay, I'll just write this down for you. So the major contribution for the development of diaphragm is septum transversum. Okay, I'll just write in short. Very good, Sachin. Very good, Rishi. Yes, and this septum transversum is going to form what? The central tendon of the diaphragm. Central tendon of the diaphragm. So the major contribution for the formation of diaphragm is the septum transversum that forms the central tendon. The second one is the pleuroperitoneal membranes, right? This is very important. A diaphragm as a topic is very important. Pleuroperitoneal membrane, what is that going to form? That is going to form the posterior part of the central tendon. Posterior part of central tendon, right? Then there's something known as dorsal mesentery of esophagus. Yes, but what is this going to form for the diaphragm? Dorsal mesentery of esophagus. Any guesses? What is this going to form for the diaphragm? Yes, this forms the crus of the diaphragm. Crus. And finally, the body wall. The body wall forms the peripheral part of the diaphragm. Hi, Vishwesh. I'm fine, bacha. How are you? Peripheral part. You remember this? Embryology, peripheral part of diaphragm. Yes. Okay. Right. Okay, very good. So just remember, बच्चों, this diaphragm comes as an LQ for you. LQ में एक topic होगा embryology, development of diaphragm. So the main contribution to the development of diaphragm is septum transversum, and that is going to form the central tendon. The second is the pleuroperitoneal membrane, and that forms the posterior part of the central tendon. The dorsal mesentery of the esophagus, that forms the crus of the diaphragm, and the body wall that contributes to the peripheral part of the diaphragm. So this is going to form the structure of the diaphragm. The muscles of the diaphragm, are derived from. That's another very important MCQ. Bacho, can anyone answer this? Hi Rutvi, hi. Yes, very good, Vishwesh, yes. The muscles of the diaphragm are derived from anyone. The muscles of the diaphragm, another very important MCQ, bacha. The muscles of the diaphragm are derived from the neck. The cervical myotomes. The cervical myotomes, they migrate down and they form the muscles of the diaphragm, and that's how the nerve supply of the diaphragm is the phrenic nerve. Phrenic nerve, correct? So phrenic nerve is the one which supplies the motor supply to the diaphragm. The phrenic nerve is also sensory to the central tendon of the diaphragm. The peripheral part of the diaphragm, the sensory nerve supply, is the intercostal nerves. Remember that. Yeah, a quick revision. Yes, very good, Snehajit. Very good. Perfect. Clear? The development of diaphragm I've covered. And suppose if this pleuroperitoneal membranes are not formed, there's a communication between the pleural and the peritoneal cavity, and this is a hernia. Can anyone tell me what is this hernia known as? Yes, bacha. Anyone? Come on. What is that hernia? जिसमें वो pleuroperitoneal membranes do not fuse the structures from the abdomen, they migrate up into the thorax. This hernia is known as Bochtelec's hernia. Bochtelec's hernia. Pratik. This is physics wala going on, physics wala. This is what we call as Boctelic's hernia, right? Yeah, so Boctelic's hernia is non-fusion of the pleuroperitoneal membranes. Perfect. Very good to all of you. So just remember this primitive streak formation of the subdivisions of intraembryonic mesoderm and all. That's very important. Okay. So I'll start with this interatrial septum, bacho. Interatrial septum is another very important topic for you. Look, this is the atria here, and below is the ventricles here. What is this structure which separates the atria from the ventricles? Very good. Chalo, bolo bacho. What is this structure which separates the atria from the ventricles? That's a cushion. What is this cushion known as? This is what we call as the AV cushion. Okay, or this is what we call as the endocardial cushions, AV cushion or the endocardial cushion. And this AV cushion, there's someone who migrates into this AV cushion. But can anyone tell me who migrates into this AV cushion? And if these cells do not migrate into this AV cushion is not formed. And this results in septal defects, interatrial and interventricular septal defects. So this is the AV cushion, and yes, very good Vinay, very good Prachi, very good bacha. नहीं, I'm not asking that bacha. ये AV cushion जब बनता है ना, AV cushion, there are some cells which migrate into this AV cushion. I want the name of those cells. Come on, think. What are those cells which migrates into the AV cushion? Huh? Matlab na, this will cover everything, bacha. I may not touch a particular topic, but I may not enter into that details, but I'll just touch the topic and go. What are the cells which migrates into the AV cushion or the endocardial cushion? Bacho, these are the neural crest cells. Neural crest cells, very important. If this neural crest cells do not migrate into the AV cushion, the AV cushion is not formed. Agar AV cushion nahi banta, so that results in an interatrial and an interventricular septal defects. Just remember this. Neural crest cells, yes, neural crest cells. Perfect hai? हाँ, ये याद रखना. This is very important. This can come as a clinical MCQ also. So who migrates into the AV cushion? NCC, neural crest cells. Okay, I'll start. There's a septum. Neural crest cells, yes. What is this structure here? What is this structure here? What is this structure? This is known as okay, I'll make it here. This is known as the septum spurium, and this septum spurium is formed due to absorbed right horn of sinus venosus. The septum spurium is formed due to absorbed right horn of sinus venosus. Okay, now there's a septum which starts to grow from the wall of the atrium. What is this septum known as? This is the septum primum. Just listen, bacha. The septum primum starts to grow from the wall of the atrium. It is growing towards the AV cushion, right? It's coming towards the AV cushion. What is this opening known as, bacho? What is this opening known as? This opening is known as the foramen primum or the ostium primum. Foramen primum or the ostium primum, right? Now this septum primum fuses with the AV cushion. The septum primum fuses with the AV cushion, and जैसे ये fuse हो जाता है, it breaks off in between. The septum primum fuses with the AV cushion, and then it breaks off in between. What is this opening now known as? This opening is now known as the ostium secundum or foramen secundum. Right? Now, another septum starts to grow here. Look, another septum starts to grow from the wall of the atrium. What is this septum known as? This is known as the septum secundum. That's known as septum secundum, and the septum secundum comes and lies next to the septum primum, and this opening is now known as what? This opening is now known as the foramen ovale. That's foramen ovale. You get a short note on development of interatrial septum, bacho. Just remember this interatrial septum. So septum primum starts to grow from the wall of the atrium. It comes towards the AV cushion. The gap between them is known as the ostium primum or foramen primum. The septum primum fuses with the AV cushion, breaks off in between. The opening is now known as ostium secundum or foramen secundum. Now another septum starts to grow from the wall of the atrium. It lies next to the septum primum, and this opening is now known as foramen ovale, right? Foramen ovale. Now you tell me, bacho, what happens when the blood comes in right atrium? Look, when the blood comes in the right atrium through IVC and SVC, the blood in fetal circulation, the blood directly goes in the left atrium, right? It's pure blood, no? It's pure blood. So this pure blood goes into the left atrium. From the left atrium, it goes into the left ventricle, and from the left ventricle, it goes into the entire body. Okay, once the child is born, that's fetal circulation. Once the child is born, once the child starts to cry, the lungs inflate and the blood starts to come into the left atrium. The pressure inside the left atrium increases, and this septum primum goes and falls on the septum secundum, and this is what is going to close our foramen ovale. Okay, so the septum primum goes and falls on the septum secundum, and that closes the foramen ovale. MCQ hai bachcho, the final closure of foramen ovale occurs due to fusion of. Final closure of foramen ovale occurs due to fusion of, your answer is septum primum and septum secundum. Septum primum and septum secundum. Clear? So now clear hai bacha, if this AV cushion is not there, bolo, if this AV cushion is not there, the septum primum cannot come and join with the AV cushion, and this will result in an interatrial septal defect. Interatrial septal defect. Okay? कैंटल्स लाइन है बच्चा, वो कैंटल्स लाइन है, कैंटल, कैंपल्स नहीं, कैंटल्स लाइन है, वो है ऐप में है, जस्ट गो थ्रू इट, आई हैव गिवन इट इन द ऐप. Okay, fine. Now just coming to this interventricular septum, I'll tell you later. Listen, interventricular septum is made up of two parts, right? Number one, this part grows in the floor of the ventricular cavity. Look at this. This part grows in the floor of the ventricular cavity, and this is what we call as the muscular part. Muscular part of the interventricular septum. So interventricular septum is made up of two parts. एक है muscular part, दूसरा है membranous part. The muscular part starts to grow in the floor of the ventricular cavity. The membranous part is derived from two sources. Number one, there's a septum which is formed here in the conus, and this septum is what we call as the bulbar septum. So the membranous part of interventricular septum is derived from, number one is the bulbar septum, and number two is the proliferation of this. What is this? AV cushion. समझ में आया बच्चों? So if the AV cushion is not there, the interventricular septum will also not be formed. So interventricular septum is of two parts. One is the muscular part and the other one is the membranous part. Okay, remember it like this: muscular part, membranous part. Muscular part grows in the floor of ventricular cavity. So muscular part grows in the floor of the ventricular cavity. Membranous part is derived from two sources. One is known as the bulbar septum, which is formed in the conus, and second one is proliferation of AV cushion. Proliferation of AV cushion. Clear है बच्चों? Hilton's line, बच्चा. Hilton's line is the one which Hilton's line. Hilton. अरे मेरे बच्चे, ऋत्वी, Hilton line कहाँ पे होता है? The white line of Hilton है वो. White line of Hilton is in the anal canal ना बच्चा. White line of Hilton anal canal में होता है. What you are talking about is what line? Any guesses? What is Ritvi talking about? Ritvi is talking about a line. What is that line known as? Yes, bolo bachcho. Anyone? Jo, the extravasation of urine from the abdomen into the lower limb, that is prevented by what line? कैसे याद रखते हैं? This line is going to hold the urine. That line is known as Holden's line, बच्चा. Holden line is different. Hilton's line is different. ठीक है ना? हाँ. Okay. ठीक है, no confusion बच्चों. Okay. Now you tell me, what are the three veins which opens in the sinus venosus? Sinus venosus is the venous chamber of a primitive heart, right? Primitive heart के चार chambers हैं. Just answer this. Primitive heart has got four chambers like this. This is one, this is two, this is three, and this is the fourth chamber. So what is this known as? This is what we call as the, yes, bulbous cordis. Embryology of heart is very important. Fetal circulation, I've told you. So this is bulbous cordis, this is the ventricles, this is the atria, and this is what we call as the sinus venosus, right? Yes. So bulbous cordis, ventricles, atria, and sinus venosus. Sinus venosus, bachcho, is the venous chamber of the heart. And in this sinus venosus, there are three veins which drain into the sinus venosus. Now, this is a very important MCQ, bachcho. This you should know. What are the three veins which drains into the sinus venosus? For the simplicity, I'll label this veins for you. Okay, this is number one. ये बोल सकते हो, what is this vein? This is the placenta, and there's a vein which comes from the placenta. What is that vein known as? The umbilical vein, right? So the veins which opens into the sinus venosus, number one is the umbilical vein. Umbilical vein कहाँ से आती बच्चा? Placenta से. The second vein comes from the yolk sac. What is this vein known as? The vitelline vein, the vitelline vein. The second vein comes from the yolk sac, that is known as the vitelline vein. And the third vein comes from the body wall. It drains the body wall above the heart. Drains the body wall above the heart. What is this? Number three. This is what we call as the anterior cardinal vein. Anterior cardinal vein. And this number four is known as the posterior cardinal vein, right? Anterior cardinal, posterior cardinal joins to form this. Number five. What is this? Number five. This number five is the common cardinal vein. Common cardinal vein. Okay, so what are the veins which drains into the sinus venosus? Number one is the umbilical vein. Number two is the vitelline vein, which comes from the yolk sac. And number three is the common cardinal vein, which comes from the body wall. Body wall. Okay, bachcho. So these are the three veins which opens in the sinus venosus. Perfect. Now, let me just tell you this. This is a very easy slide, but this is extremely important, bacha. So this is the anterior cardinal vein. I'll just draw this, bacha, for you. This is the anterior cardinal vein which drains the body wall above the heart like this. And what is this vein? That's the posterior cardinal vein here. That's the posterior cardinal vein. And what is this? That's the common cardinal vein, right? So ye hoga posterior cardinal vein like this. That's the anterior cardinal, posterior cardinal, and what is this? Common cardinal vein. I'll tell you something very important, but just concentrate here, right? So anterior cardinal vein, posterior, this is the posterior cardinal vein, this is the common cardinal vein. This common cardinal vein opens into what? Sinus venosus. Perfect. Now, there's a vein which connects the two anterior cardinal vein. This is the anastomosis. इसे हम बोलते हैं anastomosis. There's an anastomosis between the two anterior cardinal veins. There are two veins which opens in the anterior cardinal vein. What are these veins? Bacho, these are the subclavian veins. Subclavian veins. So there are two ready-made veins for us. Ye ready-made veins are, these are the two subclavian veins which opens into the anterior cardinal vein. Okay, bacho, clear hai? This is extremely important. Asked in Vivas, asked in MCQs, you get the development of SVC. As a short note. Right, so look here, that's the anterior cardinal vein, that's a posterior cardinal vein, that's a common cardinal vein. Ye right side ka hai, ye left side ka hai. Both this will drain into sinus venosus. Both the anterior cardinal veins are connected by an anastomosis. Two subclavian vein open in the anterior cardinal vein. Perfect. Now tell me, what is this going to form? What is this vein going to form? This is the anterior cardinal vein above the attachment of subclavian vein. What is this going to form? Any guesses? This is going to form the internal jugular vein. Excellent. Very good, bacho. Very good. So how is the internal jugular vein formed? Embryologically, yeah? Embryologically. वैसे आपको पता है मेरे बच्चों, internal jugular vein, gross, when we talking about gross, the internal jugular vein is a continuation of what? Gross. बोल सकते हो? Gross. Internal jugular vein is a continuation of ग्रॉस पूछा मैं. इंटरनल जुगुलर वेन इज अ कॉन्टिन्यूशन ऑफ व्हाट? हाँ श्रीमती. सिग्मॉइड साइनस. Excellent, very good Vinay, very good. That's a continuation of sigmoid sinus, very good. हाँ, sigmoid sinus है ना, jugular foramen से बाहर आती है sigmoid sinus, and that continues as internal jugular vein. That's gross. Embryologically, बच्चा, internal jugular vein is derived from the anterior cardinal vein above the attachment of subclavian vein. Very good to all of you. Very good. You're answering very well. Now, bachcho, tell me, what is this going to form? This is the anterior cardinal vein between the subclavian vein and the anastomosis. Anterior cardinal vein on the right side between the subclavian vein and the anastomosis. This is going to form our right brachiocephalic vein. The right brachiocephalic vein. Okay, the anterior cardinal vein between the subclavian vein and the anastomosis itself. अब ये क्या बनेगा बच्चों? This is going to form our left brachiocephalic vein. Clear बच्चा? That is why the left brachiocephalic vein is always longer in length. Because the left brachiocephalic vein is formed by the left anterior cardinal vein between the subclavian vein and the anastomosis itself. Perfect? Okay. Now, the right anterior cardinal vein below the anastomosis and the right common cardinal vein. What is this going to form? This is going to form our SVC. Clear, bacha? So, the SVC is derived from the right anterior cardinal vein below the anastomosis and the right common cardinal vein. Perfect? Perfect? Okay. Krutarth. Very good, Krutarth. Very good. Now you tell me, what is this going to form? This is the left horn of sinus venosus. Bachcho, bol sakte ho, what is this left horn of sinus venosus going to form? I mean, this, I'm so sorry. This is the left common cardinal vein. That's a left common cardinal vein. What is this form? Any guesses? What is this left common cardinal vein going to form? Answer, the left common cardinal vein with कैसे लिखो इसको, with the left horn of the left common cardinal vein with the left horn of sinus venosus. बोल सकते हो बच्चों? The left common cardinal vein with the left horn of sinus venosus will form what? नहीं बच्चा, pulmonary vein नहीं है ये. The left common cardinal vein. This is the left common cardinal vein, and here is the left horn of sinus venosus. This is going to form, yes, Paridhi, yes, this is going to form the coronary sinus. That's the coronary sinus. A very, very important MCQ. Yes, Rutvi, very good. So, how is the coronary sinus formed? The coronary sinus embryologically, bacha, is derived from the left common cardinal vein and the left horn of sinus venosus. And gross, bacho, gross. How is the coronary sinus formed? The coronary sinus is derived from the great cardiac vein joining with the marginal vein that forms the coronary sinus, that is gross. Very good, very good. याद आ जाएगा धीरे धीरे सब, है ना? This is a quick revision, बच्चा. This is a quick revision. And now you tell me, children, the left anterior cardinal vein below the anastomosis and the proximal part of the left posterior cardinal vein. The left anterior cardinal vein below the anastomosis and the proximal part of the left posterior cardinal vein. This is going to form the left superior intercostal vein. Left superior intercostal vein. Here, bacha. So the left anterior cardinal vein below the anastomosis and the proximal part of the left posterior cardinal vein, this is going to form the left superior intercostal vein. And this left superior intercostal vein, gross, yaad hai, gross bacha. How's the left superior intercostal vein formed? By the joining of second, third and fourth left posterior intercostal veins. And the left superior intercostal vein drains into the left brachiocephalic vein. So, ये left superior intercostal vein है, this will drain into the left brachiocephalic vein. Clear है बच्चों? Fine. Are you able to follow this? So that's the development of the veins of the upper limb. खत्म किया मैंने. Okay. Okay. Let us understand the veins of the lower limb also. ये खत्म कर देते हैं veins of the lower limb. चलो बच्चों, we'll just quickly finish this. So that's the anterior cardinal vein here, and this is the posterior cardinal vein. I'll just draw this for you. देखो development of IVC खत्म करते हैं फटाफट. development of IVC. So that's the anterior cardinal vein. अब ये छोटा सा draw किया मैंने. That's the posterior cardinal vein, and this is the common cardinal vein here. Okay. So if you remember the development of IVC, the two posterior cardinal veins are joined by an anastomosis. जैसे बच्चा anterior cardinal veins were joined by an anastomosis, वैसे the two posterior cardinal veins are joined by an anastomosis. Perfect है? Now, two new veins are formed here. Okay, look, two new veins are formed here, and both these veins would drain into the posterior cardinal vein. Right? Both these veins, two new veins are formed here, and this is what we call as the subcardinal vein. Subcardinal vein. कृतार्थ. अच्छा रुको, I'll repeat it later. ये पहले खत्म करते हैं बच्चा. So the posterior cardinal veins are दो अपने पास. The two posterior cardinal veins are connected by an anastomosis, right? Like the two anterior cardinal veins were connected by an anastomosis, right? अब दो veins form होते हैं यहाँ पे. The two veins are formed here, and both these veins are going to communicate with the posterior cardinal veins. These two veins are known as the subcardinal vein, and these two subcardinal veins are connected by an anastomosis. I'll draw this in a different color. What is this anastomosis known as? I'll write it. This is known as the intersubcardinal anastomosis. Intersubcardinal anastomosis. So those subcardinal veins are formed. It is connected by an intersubcardinal anastomosis. Perfect है बच्चा. Now two veins are here. What are these two veins known as? बोल सकते हो. Two kidneys are forming here, है ना? ये kidneys बन रहे हैं अपने. These are the two kidneys here. And what is this vein in green known as? In green, any guesses? This green is known as the mesonephric vein. Mesonephric vein. I have written in the same color, so वो उसको correlate करो. Okay, देखो बच्चों. So दो posterior cardinal veins है, two subcardinal veins are formed here. The two subcardinal veins communicate with the posterior cardinal veins. The two subcardinal veins are connected by an intersubcardinal anastomosis. Two small veins are formed here which are draining the kidneys. Naam mesonephric vein. That is mesonephric vein. Perfect? Perfect. I'm telling you, this is going to form our future IVC. अगर ये अपना future IVC बनेगा, if this is going to form our future IVC, what is this right mesonephric vein going to form? What is this right mesonephric vein going to form? चलो बच्चों बोलो. What is this right mesonephric vein going to form? The right mesonephric vein is going to form the right renal vein. I'm telling you, this blue part is going to form our future IVC. So what is the right mesonephric vein going to form? It is going to form the right renal vein. And the left renal vein is derived from, look bachcho, the left renal vein is derived from, number 1 is the left mesonephric vein. Number 2 is the left subcardinal vein. Okay, number 1 is the left mesonephric vein here. Number 2 is the left subcardinal vein. And number 3 is the intersubcardinal anastomosis. Intersubcardinal anastomosis. So this is going to form our left renal vein. Bachcho, aapne renal veins dekha hai na? You've seen the gross of renal veins. That's a IVC. Tell me which renal vein is longer and which renal vein is short. The right renal vein is shorter and the left renal vein is longer. Hai na bacha? The left renal vein is longer, the right renal vein is shorter. Why? Because the IVC is formed on the right side. That's fine. IVC is formed on the right side. The right renal vein is derived from the right mesonephric vein. The left renal vein is derived from 3 sources. Number 1 is the left mesonephric vein. Number 2 is the left subcardinal vein. And number 3 is the intersubcardinal anastomosis. Intersubcardinal anastomosis. Perfect hai ye? Development of renal veins is extremely important, bacha. Extremely important. Just remember this. Perfect. Oh, okay. Fine. Anything that you know about the left renal vein? The left renal vein lies between the superior mesenteric artery and the aorta. The left renal vein, that lies between the superior mesenteric artery and the aorta. And the left renal vein gets compressed. What is this known as? Any guesses? This left renal vein lies between, ये पीछे कौन है? This पीछे is the aorta. And what is this vein? That is the superior mesenteric vein. What is that sign known as? Huh? Vinay? समझ में आ रहा है ना बच्चा? See, the left renal vein gets compressed between the superior mesenteric artery, very good, and the aorta. ये superior mesenteric artery, ये aorta है. The superior mesenteric artery lies in front, so that is known as nutcracker sign. Extremely good. Nutcracker sign. This is an MCQ. Huh? This was a PG NEET MCQ. Nutcracker sign refers to, answer is left renal vein. बस ये याद रखना. Okay, बच्चा, I'll just clear this off. We don't need this. I'll just clear this off. Huh? Now, two new veins are formed. Okay, come on. Two new veins are formed here. And these two new veins are known as the supracardinal vein. These two new veins are known as the supracardinal vein. I'll just write it here for you. Supracardinal vein. So two new veins are formed here. That is known as the supracardinal vein. And these two new veins are going to communicate with the posterior cardinal vein. Both the supracardinal veins are going to communicate with the posterior cardinal vein. Now, there's an anastomosis which is formed here. अब ये anastomosis का नाम क्या होगा? What is this anastomosis which is connecting the supracardinal and the subcardinal vein? This is what we call as the supra-subcardinal anastomosis. Supra-subcardinal anastomosis. I've written in the same color, bacha. Okay, clear hai? So once again, just going through this. What is this vein? Okay, what is this vein? This is the posterior cardinal vein. This in orange is the supracardinal vein. This in blue is the subcardinal vein. This in gray is the supra-subcardinal anastomosis. This is the intersubcardinal anastomosis. And there is a last part which comes and joins this. This is what we call as the hepatocardiac channel. It joins the subcardinal vein. बस इतना याद रखो. That is the hepatocardiac channel. Okay, बच्चों, I'll start now. Tell me now, how is the IVC formed? Look, this is so nice. IVC is derived from. Let us start. Everything is on the right side. So IVC is derived from. One moment. IVC is derived from number one. That's the posterior cardinal vein. Posterior cardinal vein. Your IVC is derived from posterior cardinal vein. Second, the supracardinal vein. So IVC is derived from the posterior cardinal vein on the right side here, the right supracardinal vein, the supra-subcardinal anastomosis, the subcardinal vein, okay. So the right posterior cardinal vein, the supracardinal vein, the supra-subcardinal anastomosis, the subcardinal vein, and finally the subcardinal vein, and finally is the hepatocardiac channel. This gets cleared off. And finally is the hepatocardiac channel. So this is going to form our IVC. Okay, I'll just label this for you. IVC is derived from number one is the posterior cardinal vein. Number two is the supracardinal vein. Number three is the supra-subcardinal anastomosis. Number four is the subcardinal vein. And number five is the hepatocardiac channel. Clear, bachcho? A very, very important MCQ, very important short note for you, development of IVC. I hope you are able to follow this. Clear? Very good. Multi-talented. Very good, very good. Chalo, clear to all of you, bachcho. So development of the veins of the upper limb, development of SVC, development of IVC, we have seen this. Ek baar dekh lo. Just go through once again later. Okay, coming to this now. This is another very important thing. Development of arteries. Itna bhi ho gaya na. So then that's fine. Okay, I'll start. So, to begin with, there are two heart tubes. Look at this. To begin with, there are two heart tubes in the embryo. And from these two heart tubes, two aorta begins, right? Two heart tubes hai. So two aorta begin. The embryo is folded like this. The two aorta will first go down like this. This is ventral aorta. They arch here. That's the arch of aorta. And that's the dorsal aorta. So two heart tubes, so two ventral aorta, two arches and two dorsal aorta. Later on, the two heart tubes fuse. Look at this. The two heart tubes fuse. Then you get those four chambers, right? So the two heart tubes fuse. The moment the two heart tubes fuse, the two ventral aorta also fuse. And this is what we call as the aortic sac. So how is the aortic sac formed? The aortic sac is formed by the fusion of two ventral aorta. You've got these two arches and two dorsal aorta, which then joins to form a single dorsal aorta. Fine. So now you have one heart tube. You have got one aortic sac, and this aortic sac is formed by the fusion of two ventral aorta. You've got two arches and you've got two dorsal aorta. Fine. So when I draw it for you, I would draw it like this. Have a look at this. I'll quickly finish this. Bacha, lyrics, we are making a channel for dental students too. Yes, we are doing that. Okay, start. Have a look at this. So what is this, bacha? This is the aortic sac. And how's the aortic sac formed? By the fusion of two ventral aorta. Right? What are these two, bacha? These are the two arches. And what are these two? These are the two dorsal aorta, which then joins to form a single dorsal aorta. बाद में fuse हो जाते हैं. So that's the aortic sac. And what will this be? This is going to be the heart tube. This is the four chambers of the heart tube, right? No, that's the bulbous cordis, ventricles, atria, sinus venosus. I'm not drawing that for you now. Okay, so what is this? Once again, aortic sac. These are the two arches and these are the two dorsal aorta. From this aortic sac to the dorsal aorta, we get a series of arteries here. And what are these arteries known as? These are the aortic arch arteries. What do the aortic arch arteries connect, bacho? They connect the aortic sac to the dorsal aorta. Aortic sac to the dorsal aorta. So this aortic arch arteries are how many in number? 6. 6 in number first. The aortic arch arteries are 6 in number. Just have a look at this. So I'll just extend this for you. So kitne pharyngeal arches hote hain, bachcho? How many pharyngeal arches are there? 6, no? To begin with, there are 6 pharyngeal arches. So there are 6 aortic arch arteries. That's the first aortic arch artery. That's the second aortic arch artery. That's the third aortic arch artery. Third. That's the fourth, fifth, and the sixth aortic arch artery. So there are 6 aortic arch arteries. Third, fourth, fifth, and sixth. Right? Are you able to follow this? So aortic sac niche, it's on the ventral side, 2 arches here, and the dorsal aorta going up like this. Embryo is folded. From the aortic sac to the dorsal aorta, we get a series of arteries. This is what we call as the aortic arch arteries, which connects the aortic sac to the dorsal aorta. Each aortic arch artery lies in each pharyngeal arch. Up 6 aortic arch arteries, out of which many disappear off, right? So the first aortic arch artery disappears off. The second aortic arch artery disappears off. The third is left. The fourth is left. The fifth is gone. The fifth aortic arch artery is gone. The sixth is left. So how many aortic arch arteries hai apne paas bacha? The third, fourth, and sixth aortic arch arteries are there. The rest disappear. Fine. Okay, once again, that's the aortic sac here for you. This is the third, fourth, sixth arch artery, and that's the dorsal aorta. Dorsal aorta. Okay, I start. Now I begin. The sixth aortic arch artery is known as the pulmonary artery. ये बनेगा अपना future pulmonary artery. The sixth aortic arch artery begins from the aortic sac and goes to the dorsal aorta. This is going to form our future pulmonary artery, and this sixth aortic arch artery gives a bud to the lungs. What is this known as? This is known as the lung bud. It's an artery to the lungs, bacha. It's an artery to the lungs. Thus, the sixth aortic arch artery gives an artery to the lungs. This is known as the lung bud. On the right side, on the right side, this part of the sixth arch artery between the lung bud and the aorta disappears off. On the right side, that part of the sixth arch artery between the lung bud and the and the aorta disappears off. On the left side, what is this going to form? This is a communication between the sixth arch artery, between the future pulmonary artery and the aorta. What's that? Yes, very good, Paridhi. That's the ductus arteriosus. Very good, Krutarth. That's the ductus arteriosus. So what is the ductus arteriosus going to connect? It connects the pulmonary artery with the arch of aorta. Afterward, this ductus arteriosus का क्या बनता है? Ligamentum arteriosum. Ligamentum arteriosum. Perfect. Very good. You are all answering. Excellent. Very good to all of you. Okay, now what are we left with? We are left with the third and the fourth arch artery. We are left with the aortic sac, and we are left with the dorsal aorta. Now, during development, there are two arteries which comes and joins with the fourth arch artery. During development, there are two arteries which comes and joins with the fourth arch artery, and this is what we call as the seventh cervical intersegmental artery. Seventh cervical intersegmental artery comes and joins with the fourth arch artery on both the sides. The aortic sac divides into two horns. दो horns बनते aortic sac के. This is what we call as the left horn of the aortic sac, and this is what we call as the right horn of aortic sac. Right? The left and the right horns of aortic sac. It divides into two. Okay, bachcho, I start. Now you tell me. The left horn of aortic sac, and the left fourth arch artery. The left horn of aortic sac and the left fourth arch artery is going to form what? What is this? This is going to form the arch of aorta. Okay, so how is the arch of aorta derived from? The arch of aorta is derived from the left horn of aortic sac and the left fourth arch artery. This is going to form the arch of aorta. So, bacho, now what is this left seventh cervical intersegmental artery going to form? The left seventh cervical intersegmental artery is going to form the left subclavian artery. It forms the left subclavian artery. The right fourth arch artery and the right seventh cervical intersegmental together forms the right subclavian artery. Understanding? Subclavian artery is different on both the sides. Left side base subclavian artery is derived only from the seventh cervical intersegmental artery. Right side base the subclavian artery is derived from the fourth and the seventh cervical intersegmental artery. Okay. What is this left horn of aortic sac form? The right horn of aortic sac, this is going to form the brachiocephalic trunk. The right horn of aortic sac forms the brachiocephalic trunk. Now we are left with the only one arch artery is left, which is that the third arch artery. The third arch artery is going to form what? What is this third arch artery going to form on both the sides? Common carotids. That's common carotids. So the third arch artery is going to form the common carotids. It gives a branch. It gives a bud. What is this bud for? The third arch artery is going to form the common carotid. It gives a bud for external carotid. And itself continues as the internal carotid artery. It itself continues as internal carotid artery along with the dorsal aorta. देखो बच्चों, the third arch artery is going to form the common carotids. ये छोटा सा bud देता है. It gives a bud for external carotid and itself continues as the internal carotid. अब है ना, this is going off Rishi. It continues as the internal carotid along with the dorsal aorta. So how is the internal carotid artery formed? It's derived from the third arch artery and the dorsal aorta. ठीक है बच्चों. Now this part of the dorsal aorta disappears off. Between the third and the fourth arch artery, this part of the dorsal aorta is gone. This entire right dorsal aorta disappears off. Bachcho, the right dorsal aorta disappears off. And now you tell me, what is this going to form? This is the left dorsal aorta. And the left dorsal aorta is going to form the descending thoracic aorta. This forms the descending thoracic aorta. I hope I'm clear to all of you. Very good, huh? Very good. Revision करके आना बच्चों. Revise and come, so it will be a quick revision for you. Okay. डक्टस कैरोटिकस वही है बच्चा, ऋषि ये था ना, ये दिस पार्ट ऑफ द डोर्सल एओर्टा बिटवीन द थर्ड एंड द फोर्थ आर्च आर्टरी, दिस इज नोन एज डक्टस कैरोटिकस. वो डिसअपियर होता है, दिस पार्ट डिसअपियर्स ऑफ. हाँ, the part of the dorsal aorta between the third and the fourth arch artery is known as ductus caroticus. ठीक है, clear to all of you? That's about the okay. Let's see. Now, come on, we'll see something else. Clear, Nana Rishi? Clear to all of you? Okay. Now, you tell me intermediate plate mesoderm. Intermediate plate mesoderm, we have paraxial mesoderm, intermediate plate mesoderm, and lateral plate mesoderm. What is the intermediate plate mesoderm form? It forms the urogenital system. ये ना, ये याद रखना बच्चों. Plenty of MCQs on this. This forms the urogenital system. The intermediate plate mesoderm. I'm not writing full. Intermediate plate mesoderm forms the genitourinary system. There are 4 things which are formed in this intermediate plate mesoderm. Can anyone tell me what is this? It forms the nephrogenic ridge, gonadal ridge, mesonephric duct, mesonephric duct. Just remember this, huh? So ये जो 4 चीजें हैं, the gonadal ridge, the nephrogenic ridge, the mesonephric duct and the paramesonephric duct, all this is derived from the intermediate plate mesoderm, which is going to form our genitourinary system. Fine. Now understand this. That means all this is what an origin? Mesodermal in origin. Mesodermal. Now, this nephrogenic ridge is a long ridge extending from the cervical region to the pelvic region. A long ridge extending from the cervical region to the pelvic region. This is what we call as the nephrogenic ridge. I'll draw this for you. That's the nephrogenic ridge here, extending from the cervical region to the pelvic region. And this nephrogenic ridge is divided into 3 parts. 3 parts. याद है ये. 1 in the cervical region, 1 in the thoracic and the lumbar region, and 1 in the pelvic region. What is this known as? This is known as the pronephros. What is this? Mesonephros. And what is this? Metanephros. Right? Pronephros, mesonephros, and metanephros. So this nephrogenic ridge forms a long ridge in the entire body of the embryo, extending from the cervical region to the pelvic region. In the cervical region, it is known as a pronephros. In the thoracic and the lumbar region, it's mesonephros. In the pelvic region, it is known as metanephros. Now, there's a duct which is draining this pronephros, mesonephros, and metanephros. What is this duct known as? ये जो duct है ना, which drains the pronephros, mesonephros, and metanephros, this is known as the mesonephric duct. That's a mesonephric duct. It brings the pronephros, mesonephros, and metanephros, right? And this mesonephric duct opens into the future bladder. That's the urogenital sinus. It opens in the urogenital sinus. That's a future bladder. Now tell me, the pronephros disappears off. ये disappear हो गया. The mesonephros disappears off. What is functional in us? The metanephros. Now this metanephros has a tissue in it. ये जो metanephros है ना, inside the metanephros there's a tissue named the metanephric blastema, and this metanephric blastema is going to form the secretory part of the kidney or the urine forming part of the kidney. A very very important MCQ, short note. Development of kidneys as well as kidneys LAQ आता है, उसमें one part can come as development. Okay, so now बच्चों, kidneys are derived from the metanephros or the metanephric blastema. And what does this give rise to? It gives rise to the secretory part of the kidney or the urine forming part of the kidney. What does this include? The Bowman's capsule, the PCT, the loop of Henle, the DCT. Right? Bowman's capsule, the PCT, the loop of Henle, and the DCT. All this is derived from metanephros. Now, this mesonephric duct will give a bud here. The mesonephric duct gives a bud here. इसका नाम क्या है? Can anyone tell me what is this bud known as? Come on, बच्चा. That's the ureteric bud. Very good. This mesonephric duct gives a small ureteric bud, and this ureteric bud will be migrating towards the metanephros. This ureteric bud divides and redivides, and it forms the collecting part of the kidney. So collecting part of the kidney is derived from the ureteric bud. अब ये क्या बनाएगा? What is this going to form? It forms the collecting tubules, the minor calyx, the major calyx, the pelvis ureter. Okay, so the ureters are derived from ureteric bud, which is derived from the mesonephric duct. So secretory part of the kidney is derived from metanephros. The collecting part of the kidney is derived from the ureteric bud, which forms the collecting tubules, the the minor calyx, the major calyx, the pelvis ureter. Okay, just remember this. Clear hai bachcho? So that's the ureteric part. So that's the development of kidneys. That's the development of urinary system. Perfect. Eh? Now you tell me, these two mesonephric ducts, they form the collecting part of the kidney that is common for males and females, right? Common for males and females. Now this mesonephric duct in males, what do they form in males? Mesonephric duct in males and females, what do they form common for both males and females? The collecting part of the kidney. Okay, in males, what else do they form? In males, they form the entire genital system of males except the testis. And now, bacha, because testis is derived from what? Testis is derived from the gonadal ridge. Gonadal ridge से क्या बनता है? Testis and ovaries. Testis and ovary is derived from gonadal ridge. So rest everything is derived from mesonephric duct. So what is the mesonephric duct form? Yes, it forms the epididymis, the vas deferens, the seminal vesicles, the ejaculatory duct, and the mesoderm of prostrate. Mesoderm of prostrate. Okay. So what is the fate of mesonephric duct in males? It forms the entire genital system of males except the testis. Matlab, it forms the epididymis, the vas deferens, the seminal vesicles, the ejaculatory duct, and the mesoderm of prostrate. Correct? It forms the trigon of bladder also. Trigon of bladder also. What happens to the mesonephric duct in females? It disappears off. It forms the collecting system of kidneys. Fine. After that, it disappears off. What is the remnant of mesonephric duct in females? Come on, bacho, that's a very important MCQ. What is the remnant of mesonephric duct in females? Any guesses? Yes, Soham, very good. Paridhi, very good. नहीं वो नहीं बोल रहा मैं बच्चा वो नहीं बोल रहा हूँ. What is the remnant of mesonephric duct in females? Gartner's duct. Very good, Snehajit. Gartner's duct hai. Paridhi, it's not epiphron. It's Gartner's duct. It's Gartner's duct. So mesonephric duct forms the entire genital system of males. Females may ye obliterates off and it forms the Gartner's duct. Okay, ye clinical MCQ aata hai, clinical question. Like a female comes to you with pain in the abdomen. On sonography, you find a small cyst in the broad ligament of uterus. You diagnose this as Gartner's cyst. And this Gartner's cyst is derived from, yes, that's a clinical question. The Gartner's cyst is derived from the Gartner's duct, which is derived from mesonephric duct in females. Perfect. Very good. That's mesonephric duct. Now the two paramesonephric ducts. There are two paramesonephric ducts. The two paramesonephric ducts fuse, and the ones which fuse are going to form the fundus. They form the fundus, the body, the cervix, and the upper 1/3 of the vagina. Upper 1/3 of the vagina. इसमें गलत बताया. It forms the upper 1/3 of the vagina. It also forms the fallopian tubes. Remember that? It also forms the fallopian tubes. So two paramesonephric ducts, they fuse to form the fundus, the body, the cervix, the upper 1/3 of the vagina. Remember, bacha? And it also forms the fallopian tubes. The lower 2/3 of the vagina is derived from, can anyone tell me this? Yes, bacha, can anyone tell me this? So that's the development of vagina. It's upper 1/3 and lower 2/3. ठीक है. upper one thirds is derived from paramesonephric duct. हाँ ये मैंने लिख दिया paramesonephric duct. Fine fine बच्चा ऋषि. Lower two thirds is derived from what? Any guesses? Any guesses? हाँ Soham, urogenital sinus is fine, but urogenital sinus say there are two bulbs which are formed, and this is what we call as the sinovaginal bulbs. Sinovaginal bulbs, which are derived from the urogenital sinus, Yes, very good. And this is what in origin? Endodermal in origin. This is endodermal in origin, and what is this in origin? This is mesodermal in origin. समझ में आया है? So the upper one thirds of vagina is derived from the paramesonephric duct. It is therefore mesodermal in origin. The lower two thirds of vagina is derived from the urogenital sinus by proliferation of the sinovaginal bulbs. It is therefore endodermal in origin. Perfect. Be very clear about this. ठीक है बच्चा. What is the remnant of paramesonephric duct in males? In males, the paramesonephric duct obliterates off. It forms the appendix of testis and the prostatic utricle. Appendix of testis and the prostatic utricle. Fine. And there is something known as mesonephric tubules. ये है mesonephric tubules. Yeah, these are all vestigial structures. Mesonephric tubules, it obliterates off, it disappears off. What does it form in males and what does it form in females? Mesonephric tubules in males forms what is known as paradidymis. Something similar to epididymis, but it is not functional. Paradidymis, that is formed from mesonephric tubules. In females, it forms epiphron and paraphron. So epiphron and paraphron, which are the contents of broad ligament of uterus. Broad ligaments के contents है ये, हाँ, Gartner's duct, the epiphron and paraphron, and this epiphron and paraphron are derived from the mesonephric tubules. These are vestigial structures; they're not functional. ठीक है बच्चा? Fine. So that is it. Now you tell me this, another very important MCQ. What is this known as? This is the genital tubercle. What is this known as? Yes, any guesses? This is the genital folds, and this is the genital swellings. Chalo bachcho, bolo. What do they form in males and females? Or we'll write it like this: males and females. Chalo bachcho, this is another very important MCQ for you. So genital tubercle in male forms what? Penis, and in females it forms the clitoris. Penis and clitoris. Genital swellings in male forms scrotum. In females, it is going to form the labia majora. In females. And genital folds in females, it's going to form the labia minora. In females. And in males, it forms the ventral aspect of penis. The ventral aspect of penis. So genital folds in males, it forms the ventral aspect of penis, and if this genital folds does not fuse, the urethra opens on the ventral aspect of penis. What is that known as? Hypospadias. ये याद रखना. So genital tubercle, males में penis, females में clitoris. Genital swellings in male forms the scrotum, in female forms the labia majora. Genital folds forms the labia minora in females and the ventral aspect of penis in males. Clear, bachcho? Okay, very good. So just remember this. Now tell me, bacha, how many pharyngeal arches are there? Just remember those pharyngeal arches, the nerves of the pharyngeal arches, the muscles of the pharyngeal arches. and the bones and cartilages of the pharyngeal arches. Which is the nerve of the first arch? Just a quick go through it. Nerve of the first arch, if you can answer this for me. Chalo bachcho bolo, nerve of the first arch. 6 pharyngeal arches, 1 disappears off, so there are 5 pharyngeal arches. Which is the nerve of the first arch? Mandibular nerve. Very good. So the nerve of the first arch is mandibular nerve, and which are the muscles of the first pharyngeal arch? The muscles of mastication, that's temporalis, masseter, the medial and the lateral pterygoids. Tensor palati, tensor tympani, the mylohyoid, and the anterior belly of digastric. So these are the muscles of the first pharyngeal arch. Which are the bones of the first pharyngeal arch? The malleus, the incus. Which are the ligaments here? The sphenomandibular ligament and the anterior ligament of malleus. Which is the artery of the first arch? Maxillary artery. Maxillary artery. Just remember this. The nerve of the second pharyngeal arch is facial. Ye yaad rakhna bacha, this you should know. Pharyngeal arches are always asked in the exams. Nerve of the second pharyngeal arch is facial nerve. Muscles are the muscles of facial expressions. Second is the stapedius. Third is the posterior belly of digastric and the stylohyoid. आज के derivatives का diagram नहीं है मेरे पास बच्चा, but IB Singh में there's a diagram which shows derivatives in IB Singh. Which are the bones and the muscles of the bones and the ligaments of the second arch? One is the stapes bone, stapes, the styloid process, the stylohyoid, the stylomandibular ligaments. Reaches cartilage है वो बच्चा, reaches cartilage. Nerve of the third arch is glossopharyngeal nerve. Nerve of the third arch is glossopharyngeal nerve. And can anyone tell me the muscle of the third arch? एक muscle है. Nerve of the third arch is glossopharyngeal nerve. The muscle in the third arch. Yes, बच्चा. Muscle of the third arch is stylopharyngeus. ये याद रखना. So stylopharyngeus is therefore supplied by glossopharyngeal nerve. Very good. Nerve of the fourth arch is superior laryngeal nerve, superior laryngeal, and the nerve of the sixth arch is recurrent laryngeal nerve. Right now, the superior laryngeal divides into an external laryngeal, internal laryngeal. External laryngeal supplies the cricothyroid muscle, which is a tensor of the vocal cords. The internal laryngeal nerve supplies the mucous membrane above the vocal cords. The recurrent laryngeal nerve supplies all the muscles of larynx except the cricothyroid. It supplies the sensory supply to the larynx below the vocal folds. Okay. Chalo. Can you answer this for me? What is the derivative of the first? So, okay. Look at this. What is this from outside known as? Ye section hai, neck ka section hai. So, what is this from outside known as? Yo. What are these depressions known as? Yes, bacha, what are these depressions known as? From outside, these are the ectodermal clefts, right? These are the ectodermal clefts. And from inside, these are the endodermal pouches, right? These are the endodermal pouches from inside, and from outside, these are the ectodermal clefts. So what happens to the first ectodermal cleft? The first ectodermal cleft forms the external acoustic meatus. The first ectodermal cleft forms the external acoustic meatus. The second ectodermal cleft grows down and fuses with the last one. The second ectodermal cleft grows and fuses with the last one, so our neck becomes smooth. Our neck is smooth, right? So the first ectodermal cleft, bacha Rishi, वो pouch है बच्चा, tubotympanic recess, that is pouch. The first ectodermal cleft forms the external acoustic meatus. Look at that. That forms the external acoustic meatus. The second ectodermal cleft fuses with the last one, so the neck becomes smooth. Okay. बच्चा ये क्विक रिवीजन है and important topics I cover in this. Okay, now coming to the endodermal pouch. The first endodermal pouch. What is the first endodermal pouch known as? This is all important from Viva and all point of view. Viva will be superb if you can answer like this. The first endodermal pouch forms what is known as the bacha, what is that? Tubotympanic recess. The first endodermal pouch forms a tubotympanic recess And this tubotympanic recess forms two things. One is the middle ear cavity, and the second one is the eustachian tube. Second one is the eustachian tube, right? So the first endodermal pouch divides into a dorsal and a ventral part. The dorsal part forms what is known as the tubotympanic recess. This tubotympanic recess forms the middle ear cavity and the eustachian tube, right? The ventral part of the first endodermal pouch joins with the second and forms the palatine tonsil. So what is the second endodermal pouch forms? It forms the palatine tonsils. What is the third endodermal pouch forms? The third endodermal pouch, can anyone tell me what is the third endodermal pouch forms? Yes, bacha. What is the third endodermal pouch form? Bacho. What is the third endodermal pouch form? Immature scalpel. Very good. थर्ड का ये बनता है, हाँ हाँ हाँ, वेरी गुड. इंफीरियर नहीं बच्चा, इंफीरियर हाँ, इट फॉर्म्स अ थाइमस. द थर्ड फॉर्म्स अ थाइमस एंड द इंफीरियर पैराथायरॉइड्स. The third endodermal pouch forms a thymus and the inferior parathyroids. The fourth merges with the sixth. It forms the superior parathyroids and it forms the ultimobranchial body. Okay, so the dorsal part forms the superior parathyroids and the ventral part merges with the sixth and forms the ultimobranchial body. And this ultimobranchial body forms what? The parafollicular C cells of thyroid. The ultimobranchial body forms the parafollicular C cells of thyroid, but recently it has been shown that the parafollicular C cells of thyroid are derived from, come on. Till now, we used to say the parafollicular C cells of thyroid are derived from ultimobranchial body, but recently it has been shown that the parafollicular C cells are derived from. Yes, Rishi, barabar hai. Yes. Yes. You can log into PW Meded app to see for the lectures, the lectures, recorded lectures. Yes. Bacho bolo. Neural crest cells. Yes, very good. Vinay, it is neural crest cells, right? So the ventral part of the fourth joins with the sixth to form the ultimobranchial body, which forms the parafollicular C cells. But recently it has been shown that the parafollicular C cells are derived from neural crest cells. अगर MCQ आता है parafollicular C cells are derived from, your first answer is going to be neural crest cells. If not in the options, it is the ultimobranchial body. Clear? Clear to all of you? Okay, I'll just tell you quickly this. Just tell me, I'll mark this for you. What is this number 1? What is this number 1? What is this number 2? What is this number 3? And what is this number 4? Can anyone tell me this? This is the development of face. Number 1 is medial nasal process. I can't tell you everything, but the main things I can tell you: medial nasal process. Number 2 is what? Number 2 is the lateral nasal process. Number 3 is the maxillary process, and number 4 is the mandibular process. Number 1 is the medial nasal process, number 2 is the lateral nasal process, number 3 is the maxillary process, and number 4 is the mandibular process. The mandibular processes fuse, they form the lower jaw and the lower lip. Lower jaw and lower lip is derived from the fusion of two mandibular processes. If these two mandibular processes do not fuse, you will get a cleft right in the midline. This is what we call as a midline lower lip cleft. So midline lower lip cleft is due to non-fusion of two mandibular processes. Now this maxillary process will fuse with the medial nasal process and then fuse with the lateral nasal process. The two medial nasal processes fuse and form what? Look at this. What is this part known as? What is this part of the lip known as? Any guesses? What is this part of the lip known as? philtrum of the upper lip. Philtrum of the upper lip is derived from the fusion of two medial nasal processes. Okay, so philtrum of the upper lip is derived from the fusion of two medial nasal processes. If these two medial nasal processes do not fuse, bacho, we get a cleft right in the midline. We get a cleft in the midline, and this is what we call as a midline upper lip cleft. So midline upper lip cleft is due to non-fusion of two medial nasal processes. Okay, midline upper lip cleft. Now the maxillary process, this is the maxillary process, right? This maxillary process will fuse with the medial nasal process. If the maxillary process does not fuse with the medial nasal process, we get a cleft here. This can be unilateral or this can be bilateral. What is this cleft known as? This is what we call as a hair lip, or this is what we call as a cleft lip. So cleft lip is due to non-fusion of, I'll just mention this for you, non-fusion of maxillary process with medial nasal process. Maxillary process with medial nasal process, we get a hair lip or a cleft lip. Okay, first one क्या था? Midline upper lip cleft. एक मिनट, I'll just write this for you. Midline upper lip cleft is due to non-fusion of two medial nasal process. Okay, non-fusion of two medial nasal process, midline upper lip cleft. Non-fusion of maxillary process with the medial nasal process, we get a hair lip. And finally, if the maxillary process does not fuse with this, one moment, if the maxillary process does not fuse with the lateral nasal process, we get a cleft extending from the eye to the lip like this. What is that known as? Oblique facial cleft. Okay, oblique facial cleft. Oblique facial cleft is due to non-fusion of maxillary process with lateral nasal process. Okay, bacha. So just remember this. ये ना इतना याद रखो बस in the development of face, because this model is kept in the embryology table. You have a separate viva, bacha. And that embryology viva is difficult to answer. So just remember what are important things I've told you. This model in the development of face is always there in the embryo exam, right? So just remember this, how the face is formed. Two maxillary process, the lateral nasal, medial nasal process, and the mandibular processes. Mandibular process fuse, they form the lower lip and the lower jaw. If they do not fuse, you get a midline lower lip cleft. Two medial nasal processes fuse to form the philtrum of the upper lip. If they do not fuse, we get a midline upper lip cleft. The maxillary process fuses with the medial nasal process. If it does not fuse, you get a hair lip or a cleft lip. Maxillary process fuses with the lateral nasal process. If it does not fuse, you get a oblique facial cleft. Yes, very good. Now, just one last thing. Look at this. So this is a midline upper lip cleft. That's a midline upper lip cleft, right? This is a hair lip. This is a unilateral hair lip. This is a bilateral hair lip. And this is a oblique facial cleft. Oblique facial cleft. ठीक है बच्चों? Right. Just one last thing here. Okay, so I've got an MCQ for you. ये ना क्लिनिकल MCQ भी आ सकता है. Just understand the concept. बच्चों देखो है ना, clinical MCQs becomes difficult for the students to understand and answer. But just understand the basic things. वही है. So what is the answer for this? Maxillary and lateral nasal process. Okay, very good. बस एक last चीज है. Yo, tell me this. What is this? This is the hard palate, and the hard palate is derived from two sources. Correct? This is what we call as the primary palate. This is what we call as the primary palate, and this is what we call as the secondary palate. So hard palate is of two parts. है ना? एक है primary palate, एक है secondary palate. So primary palate is derived from the fusion of two medial nasal process. मतलब ये जो two medial nasal processes हैं, they fuse, they form what? Number one is the philtrum of the upper lip. This is the philtrum of the upper lip. They form this upper jaw in which we have got this four incisors, not the incisors, the upper jaw in which we have got the four incisors, and it forms a small part of the palate. That's the primary palate. So, hard palate is of two parts. One is the primary and secondary palate. Primary palate is derived from the fusion of two medial nasal processes. ठीक है? Two medial nasal processes, they form three things. One is the philtrum, second is the upper jaw, and the third is the primary palate. Secondary palate is derived from, what is this bone? Maxilla. And the maxilla will send two processes like this, and this is what we call as the palatine process of maxilla. Palatine process of maxilla. Okay, the two palatine processes of maxilla, they fuse with each other and they fuse with this primary palate, and this is what we call as the secondary palate. Okay, bacha. Look, so primary and secondary palate. Primary palate is derived from the fusion of two medial nasal processes. Secondary palate is derived from the fusion of two palatine processes of maxilla. And bacha, in us, there's a small foramen which helps us to differentiate the primary and the secondary palate. What is that? What is the name of that foramen? Anyone? What is that foramen? This is the foramen here which differentiates the primary from the secondary palate, and this foramen is known as incisive foramen. Horizontal nahi bacha, horizontal plate nahi. It's the palatine process of maxilla. Palatine process of maxilla. The incisive foramen differentiates between the primary and the secondary palates. Incisive foramen differentiates between the primary and the secondary palate. Clear to all of you? So download the MedEd app and explore the FARRE series. Okay, students, I hope this thing is clear to all of you. Jitna ho sake utna important topics of embryo I've tried to cover for you. I hope this lecture is clear to all of you. Any doubts, you can ask me on Telegram or you can send a mail. So development of heart is very important. Development of interatrial, interventricular septum, the development of aortic arch arteries, the blood vessels are very important. General embryo में primitive streak, the procaudal plate, placenta एक बार पढ़ लो, right? Abdominal embryology I've told you, genitourinary system, and diaphragm का development is very important. And finally, the derivatives of mesonephric duct, the paramesonephric ducts, the development of face, the development of palate. Okay. क्लेफ्ट पैलेट बच्चा, क्लेफ्ट पैलेट इज, अगर ये फ्यूज नहीं होता तो क्लेफ्ट पैलेट बनता है ना बच्चा. अरे बच्चे, व्हाट इज म्यूलरियन डक्ट? विनय, म्यूलरियन डक्ट इज पैरामेसोनेफ्रिक डक्ट. पैरामेसोनेफ्रिक डक्ट इज म्यूलरियन डक्ट, राइट? देखो ना, इफ दिस परिधि, लुक, इफ दिस टू पैलेटाइन प्रोसेस है ना, ये दो पैलेटाइन प्रोसेसेस है. इफ दिस टू पैलेटाइन प्रोसेसेस, सॉरी व्हाट हैज हैपेंड? Look, this is the primary palate, this is the primary palate, and this is the secondary palate. Barabar, that's the secondary palate. If they do not fuse, matlab two secondary palate, two palatine processes of maxilla does not fuse with the primary palate, we get a Y-shaped defect. This is a Y-shaped defect. ये cleft palate बन गया ना. If these two palatine processes fuse, देखो palatine processes fuse हो गए, both the palatine processes fuse, but they do not fuse with the primary palate. You get a V-shaped defect. V-shaped defect. Okay, so this is how we get the defects. Okay, hindgut, bacha, hindgut. Okay, देखो, the last part of the gut is known as the hindgut. The last part of the gut is known as the hindgut. This is the allantois. That's the allantois, है ना? The part of the hindgut below the attachment of allantois is known as cloaca. ठीक है, ये देख लो बच्चा. So ये the last part of the gut is known as the hindgut. ये बराबर है. There's the allantois which is attached to the hindgut. The part of the hindgut below the attachment of allantois is known as the cloaca. एक septum बनता है बच्चा. This septum is known as the urorectal septum, and this urorectal septum is going to divide the cloaca into two parts. The part in front is known as the urogenital sinus, and the part behind is going to form the rectum and anal canal, right? So the urorectal septum is going to divide this cloaca into a part anterior जिसका नाम है urogenital sinus, and this urogenital sinus is going to form our future urinary bladder, and that's how the urinary bladder communicates with the umbilicus through the allantois or the urachus. This part is going to form the rectum and the anal canal, right? Now, what is this membrane here? This is the urogenital membrane. The urogenital membrane gets divided into two parts, or this is the cloacal membrane, which gets divided into two parts. A part in front is known as the urogenital membrane, and a part behind is known as the anal membrane. Anal membrane. So, anal canal is 38 millimeters in length. The upper 15 millimeters of anal canal, we get such columns here. What are these columns known as? Anal columns. The lower end of the anal columns, if you join here, you get a line which is known as the dentate line or the pectinate line. Okay, this is the dentate or the pectinate line. The middle 15 millimeters of anal canal, there's nothing specific here. The lower 8 millimeters of anal canal is formed by invagination of the ectoderm. ये जो ectoderm है ना बच्चा, this ectoderm is going to invaginate inside, and this is what we call as the proctoderm, and that's how we say the lower 8 millimeters of anal canal is what in origin bacha? It is ectodermal in origin, right? Whereas the 15 millimeters of anal canal is endodermal in origin. Endodermal, the lower 8 millimeters is derived from ectoderm. इसमें भी this part is lined by stratified squamous non-keratinized epithelium, and the lower part is actual skin. You get hair follicles here. This part is lined by stratified squamous keratinized epithelium. And what is this line here known as? This line is known as the white line of Hilton, right? So the white line of Hilton represents the stratified squamous non-keratinized from stratified squamous keratinized part. ठीक है बच्चा? So I hope, thank you to all of you, my dear children, for a very patient listening. I hope these things are clear to you. In case of doubts, get back to me. Okay. Thank you. I'll stop here. Thank you to all of you. Thank you.